live. Yeah, it's been a couple of days. I went live, and I am here again. Okay, so today we talked about myths on fibroid the last time. So today we are talking about how the antibiotics you take, how they can affect or how they can cause that yeast infection you are battling with, or how they can make it worse. Yeah, right? So yeah. Um so first off, I want to start this life with a story. Yes, I want to start with a story. Okay, few days back, a patient walked in, a lady, she walked in and laid some complaint. She had acne breakout on her face, so she wanted a solution. According to her, she has taken so many drugs. People have prescribed antibiotics for her, but none is working. So, but she left some details about what was wrong with her from me, best known to her. I don't know why she did that. But when the doctor came and was clerking her, she opened up that for some days, she has noticed some cheese-like discharge from her vagina, right? So, I was like, "You've been taking antibiotics?" She said, "Yes." So I knew, because I had to ask, "Have you been using other toilets except your own private toilet?" She said no. "Do you use your towel, any or your personal belongings with another person?" She said no. So I did my clocking and I found out that it's probably the antibiotic she's been taking that led to that yeast infection. How do I arrive at this conclusion, you may ask? Because the truth is, antibiotics are for infections, right? They are for infections, but they can also cause that infection. Yes, they can also cause that infection. So, can antibiotics cure or prevent or treat infections? They can, but they can also cause you to have what is it called? It can also cause you to have infections, right? So antibiotics are designed in this life. I'm going to talk about how antibiotics are designed to work, how they cause how they can cause yeast infection, and how you can prevent it from happening to you. Yeah, and if you're having already yeast infection, how you can get it treated. Okay, so this is what I'm going to talk about on this live. Thank you for joining me. I see you. Thank you so much. So antibiotics are built pharmaceutically. They are made to actually attack bacteria. Yeah, they are made to attack bacteria and other, like protozoa and other things, like, but basically they are made to attack bacteria. Now when pharmaceutically, the body has receptors. Now each antibiotic has its own receptor it binds to. Each antibiotics, it has its own designed receptor known in the human body that it binds to. It does not bind to any other receptor, and that is how they work. Now when you take antibiotics or when you are injected with antibiotics, it goes straight to that receptor, right? It goes straight to that particular receptor of it. And that is why when you take a drug, it does not act on your whole body as such. It manages where the problem is. Yeah, it goes straight to where the problem is. So when you take antibiotics, the same route of action, the same mechanism of action it takes. So it just goes straight to the receptor, binds to that receptor, and looks for where the problem is and corrects it. That's just it. That is how antibiotics works, right? Yeah, that is how antibiotics works. Now, there is what we call normal flora in the human body. It's on the skin, it's on the mouth, it's on the guts, it's also in your vagina. So as a lady, you have what is called normal flora. It's in your vagina, it's in your mouth, it's in your guts. You have what is called normal flora. What does this normal flora do? The normal flora sits on as a guard. Like on the skin now you have normal flora, and that is why infections don't easily penetrate into your skin. Okay, that is why infections don't easily penetrate into your skin, because of the normal flora. They act as, you know what is called forest guard. So they act as a guard in that particular area they are. So in the vagina, we have lactobacillus. This is the normal flora of the vagina. Lactobacillus is a bacteria. What it does is it helps to maintain the normal environment of your vagina. Without this lactobacillus, you will always be treating infection all the time. Like, you will be so drained, buying drugs, going to the hospital, meeting your GP to prescribe drugs for you. So this lactobacillus helps to prevent these infections. Okay. So when you take antibiotics, some are known as broad spectrum antibiotics. Now, this broad spectrum antibiotics, sometimes they don't even know the one that is positive bacteria, the one they should keep, and the one they should not keep. Alright? They don't know the one that is positive bacteria and the one that is not positive bacteria. So when you take antibiotics that are broad spectrum, example like your ciprofloxacin, your amoxicillin, your augmentin, your levofloxacin, your tetracycline, your ceftriaxone, your flagyl, these are broad spectrum antibiotics. They act on both gram-negative and gram-positive bacteria. They act on both the good bacteria and the bad bacteria in the body. Okay, so when you take any of these antibiotics, they'll probably bind on their receptor and start acting on the body. Once they see a bacteria, they act on it. Right? So when you take antibiotics, it also affects, even though you're not taking it because you have infection in your vagina. No, it might be another cause. Just like this lady, she was taking antibiotics because she had an acne breakout. And in the course of treating this acne breakout, she started having discharges from her vagina. She's treating acne breakout, but at the end, she started having discharges from her vagina because she took broad spectrum antibiotics. Right? She took broad spectrum antibiotics, and this broad spectrum antibiotics, it just acted the way it should act, and decided to act on any bacteria that comes its way. Now, a very important point is to note is that yeast also survives in your vagina. Yeast also survives in your vagina, and that is because it can cohabit, it can live together with the chief bacteria that stays in your vagina. As a lady, I've mentioned before, you have lactobacillus as the chief bacteria that resides there. So when you take antibiotics, it also affects that good bacteria. Now, when the good bacteria is there, it suppresses the yeast that is in your vagina. That is what it does. So when the good bacteria is in good shape, it suppresses the bad bacteria, your yeast. Now, when you've taken antibiotics, right, and the antibiotics acts and suppresses the good bacteria, which is lactobacillus, see what is going to happen. The lactobacillus will deplete in number and its activity. Some antibiotics act as bactericidal or bacteriostatic. Bactericidal is that it kills the bacteria itself, and bacteriostatic is that the mechanism is that it makes the bacteria inactive. It inactivates the bacteria, and that is exactly what your broad spectrum antibiotics does. Most often it kills the bacteria itself. And now imagine 90 or 80% of the lactobacillus in your vagina is being killed. What will happen now is that the growth of the yeast in your vagina will come up. It will increase. Remember I said that the yeast and the lactobacillus, they can survive, they can cohabit very comfortably in your vagina. So when the lactobacillus is being killed, when it's being rendered inactive to some extent, the yeast begins to grow more than the lactobacillus. The lactobacillus that was regulating the growth of the yeast is now killed. Okay, so that is exactly what happens. So when you might be thinking you are treating an infection, but at the same time you are causing harm to yourself. So before you take an antibiotics, before you decide to abuse it, before you decide to go into taking random drugs that people prescribe without the doctor's prescription, think of this. Is it going to affect your is it going to affect is it going to affect your vagina pH? Is it going to affect that good bacteria in your vagina that is helping to guard your vagina? Yeah, that is what you should think of. Okay, so this is exactly what happens. This is exactly the route that antibiotics take. Now you may wonder, how do we now still use antibiotics to treat these infections? Before a doctor prescribe antibiotics to treat a yeast infection, we have to culture those discharges, those yeast, those cheese that is coming out from your vagina, those cheese-like discharge. It will be cultured. Why is it being cultured? During microscopy and culture and sensitivity in the laboratory, this yeast that is causing from your vagina will be exposed to so many antibiotics. And then we monitor the growth. The microbiologists will monitor the growth and know exactly which one kills or which one renders this yeast infection inactive. That way, the culture medium will be spread, and you see amoxicillin, ciprofloxacin, levofloxacin, tetracycline, doxycycline, so many of them in that culture medium. And then the microbiologists will now look at and say, okay, this one was able to kill this was able to kill this was able to kill this. All right, and that way she will know, he or the microbiologist will tell the doctor, look at what this yeast reacted to, look at the one that he didn't react to, look at the one that was able to work on this discharge, look at the one that is not able to work on the discharge. Okay, so that way the doctor will be able to know, okay, if I give this medication, it's going to attack this yeast and suppress its growth to allow the lactobacillus to grow even more. All right, so this is exactly what to do. So before the same steps now to take to prevent this from happening, if you're already having an infection already and someone else prescribed a medication, and even if the doctor prescribed a medication for you, and you notice some discharges, you notice some discomfort around your vagina, please go back to the doctor and make some lay some complaints about this. So that is exactly how these antibiotics that we take can cause or can make you to have yeast infection. All right, so when it's consistent, when it keeps happening, please try to see or try to go to the hospital, try to see a doctor for it. Don't think that any little thing that happens to your body you rush and take antibiotics. Please remember, resistance is also applicable to all these antibiotics. Don't abuse them, don't take them at random to avoid being resistant to them. Okay, so so this is just the little tips I have this afternoon to give you. For those that join my live, thank you so much for joining. I'm deeply grateful. If you have any question, please drop in the comment section. Drop in the comment section. I'll be there to answer you. All right, thank you very much for joining. I'll be going off now. See you at night or see you later. Bye bye.